Steatosis. What is steatosis? Steatosis means accumulation of fat, that is triglycerides, in hepatocytes. Normally, we see the fat as clear in histopathological slide. Why it looks clear? Because we fix every tissue in formalin fixative. Fat gets dissolved in formalin. That's why the slides looks clear. If it is fat, if you want to see fat as color, you can use oil red O or southern black. Oil red O stains fat as red in color, but we can't use the oil red O in already fixed slide. It is used only in frozen sections. So in frozen section, we use oil red O. If it is already fixed tissue, we use southern black. It stains fat as black. Myelin figures. What is myelin figure? So in cell injury, cell fluids get accumulated in the cell, inside the cell. Okay, normally cell membrane made up of phospholipids. Because of this fluid accumulation, phospholipid in the cell membrane pinched off from the cell membrane and gets accumulated inside the cell. So these phospholipid accumulation will be like the whirling pattern. So this is called myelin figure. So this world appearance best seen in electron microscopy. It is seen in cell injury. It is less in number in reversible cell injury, and it is more in number in irreversible cell injury. Thank you. Okay, apoptotic body. What is apoptotic bodies? Apoptotic bodies are oval, round, pinkish in color, which is seen in irreversible cell injury. Okay, which will go for death by apoptosis. Okay, why it is in pink in color? In apoptosis, endonuclease get activated. These enzymes digest all the nuclear chromatin material into equal size DNA material. Okay, so because of that, the DNA gets dissolved. Normally, in cell, cytoplasm stains pink color, nucleus stains blue color. Correct. So in apoptosis, because of endonuclease enzyme, the DNA material gets dissolved so that the cell will be in pinkish in color. Okay, and in slide it look like the apoptotic cells, which is small in size. Around that cell there is some cleft seen. Okay. Next, where it is seen. So it is seen in viral hepatitis, it is called as Councilman bodies, and in lichen planus, it is called as Suvet bodies. Okay, what is the fate of these apoptotic cells? These apoptotic cells are cleared by phagocytosis. How? The inner membrane of the apoptotic cells has phosphatidyl okay, because of flipping is a mechanism by which the phosphatidyl is exposed outside, which is the signal for macrophage. Okay, so that the macrophage come eats and clear the cells, the apoptotic cell. It is about apoptotic body. DNA electrophoresis. In apoptosis, DNA electrophoresis shows step ladder pattern, but in necrosis, it shows diffuse pattern. So how it shows like that? So in apoptosis, the endonuclease enzymes gets activated, so it breaks the linker molecule at chromatin, so that the DNA cuts into equal sized pieces. So it's the size is about 180 to 200 base pairs. So that it looks like step ladder pattern. In necrosis, the DNA is at different lengths, and it's look like the peripheral smear which we made in slide. Thank you. Next, metaplasia. What is metaplasia? Metaplasia means one type of cell change into another type of cell. That is, for example, epithelial metaplasia means squamous to columnar or columnar to squamous, like that. In mesenchymal metaplasia, the example is myositis ossificans, in that the muscle change into bone. So, an important example for metaplasia is Barrett's esophagus. So, what is Barrett's esophagus? So, it's due to GERD, gastroesophageal reflux disease. Okay, in that, normally the esophagus is lined by squamous epithelium, stomach and intestine lined by columnar type of epithelium. Because of GERD, the squamous epithelium of esophagus is changed into columnar epithelium. But which type of columnar epithelium? That is important. First, in stomach, we get in stomach it is a columnar epithelium, and also intestine there is a columnar epithelium. But in stomach, the columnar epithelium have Neutral mucin. Why? Because stomach is acidic in nature. That is why the columnar epithelium has neutral mucin in it. So it is stained by pus. So stomach columnar epithelium is pus positive. Okay, but in intestine naturally alkaline in nature. So intestinal columnar epithelium have acidic mucin. It is stained by Alcian blue. So stomach is pus positive, intestinal epithelium is Alcian blue positive. In Barrett's esophagus, we mostly get that intestinal type of metaplasia. That is, in Barrett esophagus, it shows Alcian blue positivity. Thank you.